2020 was like a horrific Hollywood film depicting the apocalypse like pandemic, which was the second largest one over the past century following the Spanish flu that swept the world for 2 years. Countries such as the US, with the most advanced healthcare system but suffering the highest death toll, surpassing its world 2 fatalities, failed to contain the virus spread. COVID-19 epidemic had adverse economic impacts on the rest of the world as well. The impact of rising cases was clearly evident in India. With no vaccine or treatment for the virus, it got difficult for not just India but the whole world to contain the spread of the virus. On 24th March 2020 at 8 pm, the Prime Minister of India announced a nationwide lockdown due to the sudden increase in cases of COVID-19, which was to be implemented after merely 4 hours.
देश के हर राज्य को, हर केंद्र शासित प्रदेश को, हर जिले, हर गांव, हर कस्बे, हर गली मोहल्ले को अब लॉकडाउन किया जा रहा है.
It was a sudden announcement without any preparatory guidelines or a roadmap addressing even elementary concerns of support for those whose livelihoods have been threatened. This accounted for more than 90% of the workforce in the country's unorganized or informal segments, including daily wage workers, of which a significant share consisted of migrant workers. The images of distress and exodus of workers clutching their meager belongings, often carrying children and elderly on the shoulders and backs and trudging hundreds and thousands of kilometers, determined to somehow reach their home, were seen on several news mediums. Clearly, they had not only been ignored by the government, but had also been effectively abandoned due to their complete lack of preparedness in dealing with their plight, unlike in the most other countries that opted for the lockdown. By February 2021, it seemed like India had gotten COVID-19 under control, with daily cases falling nearly 90% from the peak of the first wave last year. But suddenly, the country started experiencing the world's worst outbreak, with new cases surging past 400,000 per day and breaking the record for the highest single-day figure globally. As India reported a record number of COVID-19 cases and deaths, the migrant crisis still continued. Every state in India had announced mini lockdowns or extended them to curb the rise of record infections in the country. The current lockdowns have been tougher for migrant workers compared to the last year's All India lockdown, since the months of unemployment in 2020 had left them with little or no savings. And now jobs are scarce and living costs have rocketed. The story of workers is the same across the country, struggling to return to their home states. Their inability to access adequate and often basic food essentials in cities where they work, and coping with a fall in the income. Its effect on the informal sector, which had barely recovered from the effect of the first lockdown in 2020, has been debilitating. Besides job precarity, the migrant workforce is facing another grim reality, which is hunger. Migrant workers have been left to fend for themselves more during this lockdown than the last year. Unlike last year, when there were trains and relief measures, workers seem to be left on their own, despite Supreme Court orders to ensure support for them. The impact of the second wave is likely to be more serious because people have not yet recovered from the first wave's impact. In India, workers are characterized as either organized or unorganized. Those in the former category work in larger businesses and have some formal rights, but often they find it difficult to enforce them. Increasingly, the big and medium businesses are employing contract labor provided by contractors from the unorganized sector rather than the permanent workers. Some steps though had been taken by various state governments to support the poor, the elderly, the disabled, women and informal workers, including migrant workers. such as providing compensation to daily wage and construction workers, respectively, for wage loss due to disruption of economic activities, providing welfare pensions, employment guarantee program, and free food distribution. However, these efforts did not reach the informal workers since they are not registered. The interstate migrant workforce represents the lowest paid and most insecure jobs in sectors such as construction, hospitality, textiles, manufacturing, transportation, services, and domestic work. Many migrants who are now jobless may not be eligible for assistance from the government or eligible for receiving unemployment benefits. Food shortages and homelessness are therefore on the rise and may lead to the risk of modern slavery. Slowly and gradually, there have been some actions taken by the union and state governments to address some of the migrant labor crisis, but overall, it would hardly be an exaggeration to hold the view that the much needed basic package of support to the workers has been extremely inadequate till date. Governments, lawmakers, and businesses must uphold human rights and labor laws to protect the most vulnerable workers in supply chains during the pandemic. It is only reasonable that when faced with an economic shock amid a pandemic, the government should place the highest priority on the poor and informal workers so that their livelihoods are not threatened by its specific policies and negligence.